Welcome, and thank you for your interest in this topic. My name is Lindsay Kelly, and I'm the Genomic Navigator for the Maine Cancer Genomics Initiative. This initiative is made possible with support from the Harold Alfond Foundation. Today, I want to review precision medicine. So we'll discuss genetics and genomics of tumors. Then we'll discuss genomic tumor testing and targeted treatments. And finally, I'll review how MCGI is bringing precision medicine to oncology patients throughout Maine. What is precision medicine? We know that each individual cancer is as genetically unique as each of us. This means that the treatment that's right for one person's cancer might not help another patient at all. Precision medicine aims to use the genomic information of a person's tumor to determine the best individualized treatment for their cancer. To truly understand precision medicine, let's take a step back and do a quick review of genetics. In every cell of our body, we have over 20,000 genes, or sections of our DNA, that provides instructions for everything our body does. Some genes will determine how tall we'll be or what color eyes we'll have, but the genes that we're interested in cancer are actually the genes that provide our cells instructions on when to grow and divide, or when to repair themselves when damage occurs. These genes are essentially responsible for protecting us from developing tumors, and we call them tumor suppressor genes. However, we do know that these tumor suppressor genes can become damaged, causing what we call variants or mutations in the gene. This sort of damage can cause the gene to lose its ability to protect the cell. We know that there are direct exposures as well as indirect exposures that can damage a gene. Cancer develops when there's an accumulation of these damages or variants that develop over time. If a gene that tells the cell when to fix itself or to stop growing when it becomes damaged is no longer working properly, the cell might be able to grow and divide on its own and become a tumor or a cancer. These types of variants that are caused by exposures are acquired over time and they're not inherited. They are isolated to certain cells or tumors in our body, and there's no concern for them to be passed to children or family. However, in about 5 to 10% of cancers, there is an inherited variant that has been passed from a parent that put that individual at an increased risk of developing cancer. To understand this idea, we'll again go back to our review of biology. For each of the 20,000 genes that we have in every cell in our body, we actually have 2 copies of each of the genes because we get one copy from our moms and one from our dads. In the case where cancer is acquired or caused by exposures, we start off with these 2 working copies of the protector genes, but one might be damaged in one of our cells of our body by an exposure. That cell will still be okay because the other copy will be protecting it. But then, if over time another exposure occurs and happens to damage the other protector copy in that same cell, that cell will be left unprotected and be able to grow into a tumor or a cancer. In the more rare case of an inherited variant, a person could be born with one copy of their protector genes not working properly in every cell of their body. This doesn't mean that they will develop cancer or that they have cancer, but it does mean that they're one line of protection down. Then if one exposure comes along in one cell of their body and damages the other copy of that protector gene, that cell would be left unprotected and could possibly grow into a tumor or a cancer. Genomic tumor testing is a test of a tumor sample to identify which genetic variants are driving the cancer, or essentially which protector genes are not functioning properly. If we know which genes are driving the cancer, we might be able to specifically target them with targeted treatments. These therapies might include targeting the gene specifically, or even having the person's own immune system attack the tumor or the cancer. Genomic tumor testing, however, cannot determine if the variant is inherited or if it was acquired. Tumor testing might suggest that there's a suspicion that the variant was inherited, but additional blood testing would be needed to confirm if the variant is present in all of the cells of the body and not just the tumor cell. Oncologists or other providers might refer a patient for additional inherited risk testing based on their genomic tumor test results, or if they have a personal or family history that is suspicious for an inherited risk for cancer. It's important to identify those who might be at an increased risk for cancer because it might change their treatment plan. It might mean that they are candidates for additional screening in the future, and it might also help us to identify other family members who could be at an increased risk for cancer. MCGI is an alliance of Maine oncology providers led by the Jackson Laboratory, aimed at making precision medicine available for cancer patients throughout Maine. MCGI is available across the state with nearly every oncologist involved in the program. Through MCGI, Maine oncologists have increased access to cancer genomic testing and regular meetings with national oncology experts and researchers to help interpret patient test results and review the best treatment options. Finally, MCGI is committed to increasing access to personalized medicine by bringing additional clinical trials to Maine and providing guidance on accessing experimental treatments. To highlight MCGI, I thought I would go over a case scenario of one of our patients, John. John is a 73-year-old male who was diagnosed with a rare tumor of the bile duct that was not able to be removed through surgery. John's oncologist enrolled him in MCGI and ordered genomic tumor testing, which actually identified 2 targetable variants. His oncologist decided to bring his case to discussion at the MCGI Genomic Tumor Board, and John was so interested in this that he actually asked to be involved in the discussion himself. This is a picture of him at his tumor board. After the discussion, John began one targeted therapy, but after 4 months, he was showing no response. So they decided to switch him to the second targeted therapy that was identified, and since then, he's been having a great response. His last update stated that his scans show no more metastases and that his original tumor has shrunk to half the size that it was before treatment. John is a great example of the possibility of precision medicine improving patient outcomes through the use of genomic tumor information. Through MCGI, John's oncologist had an increased access to cutting-edge genomic tumor testing, as well as expert advice and to provide insights into the best personalized treatment for John. MCGI is expanding this type of precision medicine throughout Maine, and if you'd like to learn more, you can visit the link below.